Claire Betker is president of the Canadian Nurses Association. She joins me now. She's been listening in to the update on this. Claire, great to have you here on CTV News Channel.
Hi there.
One of the things that we heard Dr. Williams talk about, and they said that there's going to be a much more extensive screening process in this case. So those that are going to be now transported out of Wuhan City onto that plane and then eventually brought back to Canada, they get screened before they come to the airport. They're screened at the airport, he says, and they're then screened again before getting on the plane and then screened when they get off the plane. Talk to me about the importance of that and those measures being put in place there.
Okay, so I'm the president of the Canadian Nurses Association, and nurses, regulated nurses across this country are, huge sources of information. So that kind of information that Dr. Williams was talking about in terms of all those numbers of screening, the collaboration between international authorities, federal authorities, provincial, territorial, local. That's all part of how we respond to these kinds of situations. So, and nurses are in all of those aspects and avenues of it and are well positioned to play, I think, a very important role, both within the community as well as within the facilities that they work.
Certainly, as you're there, right there on the front line, dealing with patients not only that could potentially be infected, but as he pointed out there, that may have other illnesses, other issues that that you need to, look at and address. What is it that's also being done to ensure the protection of nurses as they're treating potential patients who could be infected there? Because, and I mean, it's something that you do every single day. But in this case, of course, we're looking at a virus that is spreading rather quickly.
Well, I think what nurses, and you did say every single day and over many, many decades and years, we've been at that point of care, that front line. And they need to protect themselves. And I think some of the ways to protect themselves is make sure that they know this information, that they have sources and places to get that accurate, evidence-informed information. People look to nurses. They're a trusted source of information. So between themselves, in the interprofessional team, but also to their families and to their communities. So make sure that they're informed. And there are ways to get that information provincially, territorially, as well as federally and internationally. So trusted sources know the protocols, and they do need support to be protected. So following the infection prevention and control protocols, they need the appropriate equipment, they need the appropriate information about that. But they also need to be able to raise concerns when they have concerns or ask questions and feel safe to be able to do that. And also to bring solutions. Nurses are everywhere in this health system, from public health and the upstream perspective all the way down to providing care for people in homes and in personal care homes. So I think to be able to raise the questions, having avenues where their voice can be heard and where they can bring their concerns. And we're certainly in conversation and in connecting to the Public Health Agency of Canada. We sit on part of that, a large interdisciplinary team. But we're also in communication with our union colleagues and making sure that, that we're exchanging information and strategies to work together to support the nurses in Canada.
Support that core team that, as you say, there works very closely one-on-one with the patients. But before I have to let you go, we heard Dr. Williams say 3 of the confirmed cases in Ontario are doing well, and they are at home, I guess, in quarantine or isolation at home. Could you lay out for us or explain to us what would deem a patient cured or cleared? Or at least put them in the situation where they can now be out of hospital, but be at home and sort of wait for things to clear up, and then they're given the full okay?
And I would suggest that there are experts. He talked about scientists and epidemiologists. He talked about so I would go to that accurate information. That's where I would look. He talked about case definition. I mean, public health is a very solid system in this country, stretched maybe, but a very solid system. So I would be looking for that accurate information at the local community level, provincial, territorial, and federal level from those that are. He also talked about it being an evolving situation, right? So it's moving and that's what it's like in an outbreak. Those things move, and that attention is important.
Yeah, certainly.
But in terms of support for nurses, I think I spoke to that, and they need support from each other, and it's stressful for them as well. So they'll be working short. There's increased workload.
Right.
And that surge capacity, right? We need that surge capacity in the system that we can actually bump up in response to these kinds of situations.
Certainly. Claire Betker, president of the Canadian Nurses Association. Great to have you here on the program, and we appreciate all the hard work that you and the nurses here in Canada do. Thank you.